And welcome to all of our listeners and viewers around the country and around the world. The House Democratic leadership is getting close to having enough votes to pass its massive health care reform legislation that aims to extend coverage to more than 30 million people while forcing millions of Americans to buy private health insurance. Wednesday saw three key developments for the Democrats. Congressman Dennis Kucinich of Ohio announced he would switch his vote and support the legislation, even though the bill does not create a public option. Kucinich's decision came 2 days after he spoke with President Obama aboard Air Force One on their way to a rally in his district. Congressman Dale Kildee of Michigan, an anti-abortion Democrat, also said he would back the bill. And a group representing 59,000 Catholic nuns endorsed the legislation. The Democratic leadership is hoping the nuns' support will give political cover for anti-abortion Democrats still on the fence. Meanwhile, intense pressure is being made on Democrats who originally voted against the bill. In recent days, President Obama has met privately with at least half a dozen dissenting Democrats at the White House. He has lobbied other lawmakers by phone. House Majority Leader Steny Hoyer said the House could take a final vote on the Senate health care bill by Sunday. House Speaker Nancy Pelosi also is considering passing the bill using a procedural tactic known as deem and pass that would avoid a direct House vote on the full Senate bill.
In a moment, we'll be joined by Congressmember Dennis Kucinich in Washington. But first, we turn to his news conference yesterday.
I know I have to make a decision, not on the bill as I would like to see it, but as it is. My criticism of the legislation has been well reported. I do not retract those criticisms. I incorporate them into the statement. They stand as legitimate and cautionary. I have doubts about the bill. I do not think it is a step toward anything I've supported in the past. This is not the bill I wanted to support, even as I continue efforts until the last minute to try to modify the bill. However, after careful discussions with President Obama, Speaker Pelosi, my wife Elizabeth, and close friends, I've decided to cast a vote in favor of the legislation. If my vote is to be counted, let it count now for passage of the bill, hopefully in the direction of comprehensive health care reform.
Congressman Kucinich speaking on Wednesday. Well, last week, the Ohio Democrat appeared on Democracy Now! Voicing his opposition to the bill.
I'm ready to listen to the White House. If the White House is ready to listen to the concerns about putting a public option in this bill. I mean, they can do that. You know, they're still cutting last-minute deals. Put the public option back in. Make it a robust public option. Give the people a chance to really negotiate rates with the insurance companies where from the standpoint of having a public option. But don't just tell the people that you're going to call this health care reform when you're giving insurance companies an even more powerful monopoly status in our economy.
Congressmember Dennis Kucinich joins us now in Washington, D.C. Well, Congressmember Kucinich, you did not get what you were asking for, yet you are now supporting this bill. Explain what happened and why you think this bill merits your support.
Well, first of all, as I appreciate that you covered that part where I said that I don't retract anything that I said before. I had taken the effort to put a public option into the bill and also to create an opportunity for states to have their right protected to pursue single payer. I took it all the way down to the line with the President, the Speaker of the House, Democratic leaders, and it became clear to me that despite my best efforts, I wasn't going to be able to get it in the bill, and that I was going to inevitably be looking at a bill that where I was a decisive vote, and that I was basically, by virtue of circumstances, being put in a position where I could either kill the bill or let it go forward, and in the hopes that we could build something from the ruins of this bill. I think that I mean, I can just tell you it's a very tough decision. But I believe that that now we need to look to support the efforts at the state level for single payer, to really jump over this debate and not have all those who want to see transformative change in health care be blamed for this bill going down. I think really it's a dangerous moment. The Clinton health care reforms, which I thought were very weak, it's been 16 years since we've had a discussion about health care reform because of the experience of the political maelstrom that hit Washington. And I came to the conclusion, Amy, that it would be impossible to start a serious health care discussion in Washington if this bill goes down, despite the fact that I don't like it at all. And every criticism I made still stands. I want to see this as a step. It's not the step that I wanted to take, but a step so that after it passes, we can continue the discussion about comprehensive health care reform, about what needs to be done at the state level, because that's really where we're going to have to, I think, have a breakthrough in single payer, about diet, nutrition, comprehensive alternative medicine. There's many things that we can do. But if the bill goes down and we get blamed for it, I think they'll be held to pay. And in the end, it'll just be used as an excuse as to why Washington couldn't get to anything in health care in the near future.
Congressman, I'd like to ask you, several other members of Congress who have had discussions with President Obama in recent days as he sought their support have said that he has essentially told them that his presidency is riding on this, that to defeat the bill would severely hamper the remaining time in his presidency and also the election in November. Did he make that argument to you as well, and did that have any impact on your decision?
We talked about that. I mean, I had been thinking for quite a while about, what this means in terms of the Obama presidency, and frankly, I've had differences with this president on the economy, on environment, on war, and so, I really hadn't given them many votes at all, but he did make the argument that there was a lot on the line, and frankly, there's been such an effort to delegitimize his presidency right from the beginning that, in looking at the big picture here, we have to see if there's a way to get into this administration with an argument that could possibly influence the president to take some new directions. Standing at the sidelines, I think, is not an option right now, because we have to try to reshape the Obama presidency, and I hope that in some small way through my participation in trying to take health care in a new direction, that I can help do that.
I'd also like to ask you about this whole issue of the procedure, this deem and pass procedure. There have been several folks in recent days who have questioned whether this is even constitutional. There was a former federal appeals judge, Mike McConnell, in the Wall Street Journal, questioned it, as have some lawyers from Public Citizen, whether it is constitutional for the House, in effect, not to really vote on the Senate, on the version that was passed in the Senate.
Well, I can tell you, as far as myself, I'm ready to vote on anything they send down. What the process is, I'm not sure how that's going to work out. I think it may depend on how many votes that the leaders in both the Senate and the House believe they have. I really haven't been involved in that discussion, and I can't give any kind of process a blessing. I don't like much of anything of what's happening here, except to say that I think that down the road we need to jump over this debate and go right to a bigger debate about how do we get health care that's significant, how do we supplant the role of private insurers. We're not going to be able to do it on this pass.